Once again, this is Dr. Brad Shaw with Shaw Chiropractic, Spinal Health and Wellness, and today I want to talk to you about carpal tunnel and carpal tunnel symptoms. First of all, it's important that you understand that only a small percentage of the population can actually get true carpal tunnel, and that is that they were born with ligaments that are too tight, that are pinching on that median nerve. If what you're experiencing is numbness or pain throughout your entire hand, then most likely that is not true carpal tunnel. And the reason is this. There are two nerves that supply the hand, the feeling and the sensation in the hand. The median nerve, which passes through the carpal tunnel, supplies sensation to the thumb, the first finger, the middle finger, and half of the ring finger. The other half of the ring finger and the pinky finger are controlled by the ulnar nerve, which does not have anything to do with the carpal tunnel. So again, if you're feeling anything in your full hand, that is not true carpal tunnel. Also, in true carpal tunnel, there will be a wasting away of these thenar muscles. It'll just look really, really thin and emaciated. There won't be this fleshy area here. Another way to test if you've got true carpal tunnel is if you take a piece of paper or if it's affecting the median nerve and you can't pull this out, then that the nerve supply is good and it's not affecting the true carpal tunnel. A carpal tunnel patient won't be able to hold on to that. They just would not have the strength to keep their thumb in there close. Now, where can these carpal tunnel symptoms be coming from? Well, there is something called pronator teres syndrome. The pronator teres muscle is a muscle that attaches these two bones in your arm and allows your arm to be able to twist like this. So as people are typing, or they're moving their mouse around, or as they're texting on their phones, using a screwdriver, knitting or crocheting, and they're making a constant rotation motion, and then their hands go numb, then it's most likely that muscle in there that in most of the population, the median nerve passes through the belly of that muscle and then comes down to the carpal tunnel. So again, another thing is if there's any involvement of the forearm, then it is not true carpal tunnel. One way to work with that muscle, or to find out if it is that muscle, is you can come down about an inch and a half from the crease of the elbow, and you might find a tender spot. And one way to overcome that, and to see if it is that if you push down on it and you rotate your hand, it's going to be tight and tender. So one thing you can do to exercise that is push in and rotate. Let go. Go back to the beginning. Push in and rotate. And you can repeat that about 10 times. And by working out that muscle, it can help alleviate the pain. Now if you want to use a cream, like right now I'll use the doTERRA Deep Blue Cream. You can put a little bit in the area and rub it in. And again, you can knead it into that muscle, and that's going to help. You can also use BioFreeze or Sombra. Use something that's going to help relax those muscles. Another thing to notice is if when you rotate your wrists, they click and pop. Being adjusted by a chiropractor who knows how to adjust extremities. Come to me, come see another chiropractor. We can help reduce the clicking and popping in the wrists, and we can also adjust the elbow to make sure that everything is able to function properly, and so that you can get back to what you like to do, whether it's a crafting or your job, and do what you need to do without the numbness and tingling in your hand. Coming up, I will show you how we can also use kinesio tape to support the carpal tunnel and help you have less pain while you recover. Have a great and healthy day.